Good morning, everyone. Sorry to start a few minutes late. There's still a few more joining, but we'll get cracking anyway, I think. So I'm Sam Webber, and I'm hosting today's webinar. This is our second one in this series, which is a weekly event now. So thank you very much all for joining. Thank you for your support. Couple of little housekeeping things. Firstly, we will have this, we're going to keep this to about 30 minutes, depending on questions. It may jump up to nearer 45. There's going to be 2 sessions for questions. We would like all questions, though, to be submitted via the chat box, and then if necessary, we will unmute if we need to get into any more granular detail. So, as I said, questions through the chat box, please. And Lottie, who is out of camera, is monitoring the chat box. So, first of all, purpose. What are you here for? So, we're talking about the LEJRELET positioning range, and you're here, I guess, because you deal with situations where you might sometimes struggle to keep people in a stable, comfortable, and pressure relieving position. We think positioning is all about stability and comfort, and actually they kind of correlate there. You know, stability should equal comfort, comfort should equal stability. So the LEJRELET range, what's it all about? I think the most challenging thing about the whole range is the name. LEJRELET is Danish. It means position easy in Danish. It's perfectly okay if you come up with your own pronunciation. We'll understand, which is all that matters. It's part of the LEJRELET family. We demonstrated the LEJRELET last week, which is the mechanised turning system. We're not going to touch on that today unless we find time at the end to use both products together. So LEJRELET is, or was designed to be simple, efficient, and safe. Just 3 key things. It's not a traditional bracketed sleep system. There is no base sheet. It doesn't need that. This is a simple kit of soft, non-fixed postural products. Simplicity, well, there's 6 products in the range. That is an underlying factor. It's not difficult to specify, and there's simple methods whereby you can work through which product works for you or which combination of products. The other thing which you can achieve is assisting or even enabling single-handed care with the products, because an example of that might be where there's 2 people, 2 carers which are needed for personal care. You might find with the correct positioning products, you can actually take that down to a single person task, because a second person is not needed to give that stability. So I think that's probably a brief backdrop as to what LEJRELET is all about. Just touching on the efficiency aspect, because they're simple, that often means that you can use them in lots of different scenarios, which will contribute to efficiency because they're versatile, I guess. They're not the kind of products that you see put on the top of a cupboard because informal carers or paid carers have forgotten how to use them, or whatever. They are a simple kit that is simple to remember how to use. So let's get into some detail, if that's okay. So my range is down here. First of all, I'm going to start with this one. This is appropriately called the Wedge, believe it or not. It's not the only wedge on the market. So this is where we're going to talk about simplicity, because that you can kind of work out the names. But there are a few key things about this, which demonstrate into some real world efficiencies, real life efficiencies. This whole kit was designed by the physiotherapist that owns LEJRELET. So there's some great ideas out there, there's great design out there, but design really should start with clinical input, which is how this range has come about. First of all, looking at what's inside these systems, obviously there's foam inside. Most of the ones that have got solid foam as such have got a dense CMHR foam forming most of the inner. That gives you your stability and pushback as such. But on the patient contact areas, so in this one with the angle, there's 40 millimeters of viscoelastic or memory foam. So you get a certain amount of immersion into the contact surface. That will often also create a little bit of a hollow. So if you've got a bit of movement or spasm, sometimes that will enable someone just to relax back into a similar position to before they started. So that's what's inside these typical products. On the outside, this is vapor permeable, breathable, waterproof material. It's obviously four-way stretch. All of the seams are fully welded, with the exception of one, which I'll explain why. So there's no chance of ingress into any of these joints here. These are not loose covers. This is the cover. Loose covers work against stability. They provide another layer which can enable something to move around a bit. You can clean these with soap and water, Clinell wipes, all of the normal cleaning methods. So certainly quite an easy material to look after from an infection control perspective. Talking about the wedge a bit more, there's some interesting measurements going on here. This one is the typical adult torso length. There's a reason for that. This measurement is half the typical adult hip width. Again, there's a reason for that. Those two combine to form a 30-degree angle on this side, which obviously has its benefits. So if it's all right, we're now going to show how to use this in a real life scenario. Harvey is waiting in the wings. Harvey, can you have a lie down, please? And we're going to look at some examples of how this simple product can be used. So first of all, before I use this with Harvey, I'm just going to point out, I'm going to put this against the cotton sheet that I've got on this bed and attempt to move it. And there's a certain amount of, you might regard it, you might describe it as a resistant kind of texture to the material. It's designed not to migrate away from the cotton surface it's on. It makes a big difference, even when you use this upright, small footprint here, but incredibly effective. Now, this is not a moving and handling demonstration. I'm not going to attempt to manually handle Harvey. I'm going to ask him to move into the positions I want him in. I'm going to show you the positioning aspects. Harvey, can you roll to face the audience, please? So in this kind of scenario, the obvious place we might start with a wedge is if Harvey was naturally starting to lie on his back, bearing in mind that a lot of people don't have that amount of flexion through this hip joint. So I'm going to take this up quite high. I'm going to rotate your shoulder blade a little bit further forward, with back rather, get that into the small of the back, and then encourage him back onto this. There's now a little bit of weight transfer going through that cushion, which helps, of course, with anchoring it. But we've got loads of stability. It's short enough so that without being crude, we can do everything we need to from a personal care perspective without getting that wedge in the way. Now, if Harvey does go into spasm or he's got behaviours that are challenging, Harvey, just try and push back against this. Try harder. So it's not that you couldn't push it out of the way, but it's incredibly effective in terms of what it does. So as I said, that's a typical example of where you might put this one. I'm going to take it out again because we might have a scenario where someone's tending to roll forward. That might be because of a dense stroke, for example. We might have a heavy upper limb. So what we could do is to put this in front of him. Now in that scenario, I want this shoulder up a little bit more, and I'm going to tuck that in, and now this can be used just to give that support to that heavy arm, but possibly also that reassurance, because sometimes I think the reason that people tend to roll back is because they're worried about falling forwards. So that visual blocker is also beneficial in that context. Again, I will take that out and show you another thing that can be used with exactly the same product. So again, it's back behind the back. I want to make sure that's quite far over. And now I'm going to roll Harvey back into a 30-degree position. His IT is in contact, or his skin rather, is in contact with the bed here, but there's no pressure. So simple product, but we've just completely removed that pressure. It is worth noting, of course, that the 30-degree position historically came from studies around respiratory aspect rather than pressure relieving. To date, I'm not aware of any evidence that truly indicates a 30-degree position is beneficial for pressure relieving. That said, it is logical that moving pressure points around as much as we can is common sense. I'm not saying anything against this position for pressure relief, just wanted to point out that the history of that position is for respiratory needs, which of course is hugely relevant right now. I was going to try and get through this webinar without mentioning coronavirus, but it is a beneficial position for someone recovering. So again, I'll take it out. Two more quick positions I'll show you. Could you just go into supine, Harvey, for me? If we weren't using the knee break, and I'll explain why in a minute, we could put a wedge in this position. Now that seems a bit crazy because obviously common sense and clinical best practice indicates the use of the knee break, but there are sometimes reasons why you wouldn't want to use it. The logical one is that beds are made to standard sizes. Humans, it would appear they aren't actually standard. So take an example of that where you've got a petite person, maybe 4 foot something, you might actually be creating shear and friction and also worsening the effects of gravity as such by having them in a fully profiled position, simply because the knee break's in the wrong position. It's no fault of the bed manufacturers. It's costly to build a bed frame to suit every person, so all they can do is optimize. In that scenario, we could use the backrest, but we could use this wedge as our knee break effectively. We can also combine it with another one in the opposite direction to create an angle for the support of the calves, or we can combine it with another product I'll come on to in a minute. Lastly, not what it was designed for, but if there's a continual challenge for people sliding down the bed, and we need to just, it's probably a big subject to discuss whether we should or shouldn't stop gravity taking somebody down, because there is a negative there with if you stop, then you could be increasing shear and friction. But if one of the aspects of sliding down the bed is that you're ending up with heels against the footboard, then we could use the wedge in that position against the bottom of the bed, standing up, and it's quite a natural angle for the feet to rest against. So there's more we can do with the wedge, but they are typical scenarios of when we might use it. I hope that makes sense. So I'm glad to see some questions are coming in on the chat box. We'll come on to that in a moment once we've gone through the different products, if that's okay. So that was wedge. This one is imaginatively named Pad High. I trust that is memorable. So you will immediately see some similarities. We've obviously got that same measurement there, adult torso, same one there, half adult hip width. Again, dense foam underneath, 40 mm viscoelastic foam on the top. This is the one that is impossible to have a fully welded seam because the foam can't physically be put in there if everything is welded up. So instead, there is a zip hidden under this flap, but it's a waterproof sealed zip. Obviously, there is a chance of ingress around the zip area. That is why we've got the flap. And it does also help in the context of which way up this is. So there's no surprises, given what I just said about that height there. There's no surprises as to how we're first going to use this. Maybe, in conjunction with the wedge, we can get Harvey into side lying. Perfect. And I can now position that leg. It's got enough length so there's no foot drop going on. Remember, a product like this actually allows for movement. You're not kind of restraining someone in a difficult or even uncomfortable position. You can move. What we often find here is that because you've got a really neutral hip position, there's flexion going on only, there's no adduction or abduction, we may find that the client is only able to get a tiny amount of flexion through the joint. And because of pain associated with those unnatural adduction or abduction movements, we may find that is translated into there's no flexion going on at all. But if we can get it in a position where it's at least comfortable, I have found in the past that by now, gently moving this leg out, you can actually achieve more flexion than what you were expecting because of the lack of pain. Combine this with the wedge in the first position I showed you, and we've now got a really practical position for personal care. Again, without being crude, getting this much flexion through the hip joint is helpful because it just opens someone up a bit, particularly if you've got a scenario where there's a lot of loose adipose tissue, then the more flexion you can get, the better. So that's a good example of how we use the Pad High. There are other methods. So again, you can use it up here to support the upper limb, or going back to a 30-degree position, I'll just spin this wedge over. Bobby, could you wiggle that way a little bit? That's perfect. I'll get that in underneath. And then we could support this leg back here. Now, we need to be careful with the hip angle, obviously, but the benefits here is that we've got the IT completely free of the bed. And interestingly enough, when we bring this leg back, we're actually taking quite a lot of pressure off the diaphragm. So it might be a scenario where we don't want to have this position for particularly long, but it will aid with respiratory conditions. So again, I will take those both out. Thank you. And just briefly, I will just show how we can recreate the knee break with both of these products here. But in this case, we're deliberately leaving the heels clear of the bed, purely if we've got a situation where we need to provide proper pressure relief for a period of time to the heels. So we will remove those. So we've had wedge and pad high. No surprises then, this one is pad low. Now, there's none of the dense foam layer in here, it's purely 40 mil of viscoelastic foam. You can use this where a pillow doesn't work. The problem with pillows is that they're great, but they migrate away. Remember on this, we've got that same material, which grips well, and we've got the combination of the pressure relieving foam inside. So we might just have a situation, and I think this is just going to clip out of the camera, so I apologise, but we might have a situation where we just want to offload the heels. A good alternative to using a bootie, nothing against the different pressure relieving booties that are out there. There obviously has been challenges in the past with clients trying to walk with the ones that aren't designed to be walked with. This one is not something that you're going to take with you if you do make an unscheduled exit. And again, it allows movement, but although here we're only increasing the height of the lower legs by 40 mil, so the heels are in touch with the bed, but there's no pressure going through the heels. We can, of course, fold it. So if there is a sole that's broken out, we could then support in that manner. I'm doing that. I'm sorry, the footboard is just covering your view. And in the same way, let's say we've got contractures. Just going to open that up again. Then we might have a situation where we're just bringing it in between the knees. And bear in mind, because this will warm up to body temperature, you will get that natural moulding around any bony prominence. Again, we can fold it. So on a good day, you might be able to get a bit more movement there. And there's lots of different positions around the body where you can put this. But you can, showing the breathability, you can actually expel the air from this. It'll take a couple of seconds, and we can use this as a pommel. Now, there are products out there like T-rolls and things like that that are designed specifically for that, and that's totally fine. But what we are getting here is some versatility with a very simple product. You're using common sense and your clinical knowledge just to put this product where you want to, or put any of them where you want to. So the air will reappear back in this one in a moment. So wedge, pad high, pad low, and this one is called the Oval. Now this is the new kid on the block. They trialled this in Denmark and it was nicknamed the walking cushion. Now the difference in here is we have got viscoelastic memory foam, but it's shredded. So in here, it's granules effectively. It's a high quality, a dense one, which means it's heavy, and you can mould this. So if it is a case of offloading a bony prominence, like an elbow, for example, then it will naturally cushion that point. Lots of different ways you can use this. It's often used in palliative care or end-of-life situations where all you're trying to do is create some comfort and offload some bony prominences. And I said it was called the walking cushion. The reason for that is what they've been trying in Denmark is to have a really regular repositioning schedule, possibly more regular than normal, like hourly, for example, and walking it around bony prominences with micro movements. So here I'm offloading the scapula, and I might come back an hour later and I might offload the IT here, and I can keep it walking. But again, you could just use it for general comfort. It's been used, I know, in chairs, which is another conversation, and it's also been used to support a drooping chin. So lots of different ways that this little oval can be used, but it is very tactile. It's the kind of thing that encourages you to snuggle into it, which I think is beneficial. So we're now going to come on to this one, and we're going to ask for some comments in the chat box actually as to what this one's called. So far we had wedge, we had pad high, we had pad low, we had oval. This is not sausage, but while I'm just putting this on the bed, we'll see if anyone gets it right. What have we got, Lottie? Give us three comments.
We've got snake.
Not snake.
We've got body hugger.
Body hugger, not bad, but it's not.
And then we've got long tube.
Long tube, perfect. Someone's been studying. Excellent. So that's the long tube, and we're going to explore how we can use this. I'm going to take the cushion out, the pillow out, pop that out of the way. Now I am just going to use the vendlet to roll Harvey in this situation. So I'm going to pop it over on this side, I think, to start with. And I've hollowed a little area here. So again, in here, it's the same filling as the oval. So I'm just going to make a little hollow for the head. And we're going to pop that there. Does that feel right, Harvey? Yep. Good. I'll come around to that side. So again, I'm moving this filling to where I want. This arm is going to be on the bed. So in this scenario, I've just hollowed that a little bit there. Now, obviously, I would probably be playing with the bed height as well at this point, but I'm going to take a little shortcut there. So remember, many situations where the vendlet is not appropriate and the tube is, but this is just an example of how they work together. So I'm going to roll Harvey on to the tube. I'm going to bring this arm up. And for clients that are cognitively aware, we can ask them to cuddle into this. Put that down because I'm going to use that down in the next thing I'm going to show. So here, good sideline position. Often clients with dementia, you can see tone, muscle tone just kind of draining as they snuggle into it. There's deliberately a lot of length. This is 250 centimeters. We may use this leftover section to snuggle around the back. We can fill if we want to bring up the hip a little bit there, sorry, the knee a little bit, but we're well supported across the body and we've got often a really high degree of comfort. Now, there's no rights or wrongs here. As I said, you're using your judgment to find ways that it's going to be comfortable. So I will take it out. Sorry, now you've just got comfortable there. I guess a good visual indicator I've had with this is where you see clients that go off to sleep when you're trying it with them, which is a pretty good indicator that it's comfortable. So now I'm supporting Harvey from the back, and remember, you can bulk up any particular area where you want to. So here we've got kind of side lying, except I can actually if I want to, I can recreate more of a 30-degree position here, but I've got really, or rather he's got really good support. So lots of ways we can use this. Harvey, just if you could roll onto your back, supine if that's okay. And now I'm going to position it like so. So I've more made a little cocoon, and we're going to go into semi-supine. I'll make sure the shoulders even are not pushed forward. And if we've got a situation here, I'm going to profile the bed in a minute. If we've got a situation here where there's a one-sided weakness, we can work with that side to make sure that we're getting maximum support. So now I'm going to profile the bed. So this is in a reasonably high position. It's not restrictive, but it is supportive. There's very little ability for someone to slump. We can, as I said, we could create more of a hollow here so that the head goes back a little bit. We could maybe make some more support. Now, before any questions do come in the chat box, a common one I'm going to answer is yes, if you need to, you can make a perfect little hollow for a gin and tonic in there. So that's the tube long, or the tube 250. There are other ways that we can use it, like we did with the wedge and the pad high. We could use it to create a knee break by having it in a U shape the other way. So starting here, down the torso, behind the knees and up the other side. So it's very versatile, and there's lots of other things we can do. One other position is a C shape. So starting, that's typically maybe if you've got a lot of wind sweeping going on, you could start behind the head, bring it down the affected side and right behind the knees. The knees tend to act as a bit of an anchor. You can bulk it up, and despite it being a soft product, you can get a degree of correction with someone that's wind sweeping badly. So that's the tube 250. Now, occasionally, it's too long, and I did say occasionally. So this is the tube 125. It's identical. It's half the length, and it shares all the same properties, including the welded seams we discussed earlier. So that is the range of products. Now we're going to stop for a moment and look at some questions that have come in. Lottie, could you just read out the first question? Would that be all right?
Yeah, certainly. So the first question is, may I ask how long the cover remains safe for cleaning regarding infection prevention?
Yeah, that's a good question. So the question, if in case anyone didn't hear, is how long is the cover safe for infection prevention? That is something which we do not stipulate as a company. It's normally prescribed, if you like, on a trust or organisation basis. One comment I've got in this regard is that although they are deliberately, as I said, no loose covers, welded seams, so they are really good in terms of infection control. But the challenge is that you can't tell if anything has gone inside. So you've got a very similar situation with a lot of mattresses and things that are all welded, is that you can't actually get inside to see what's going on in there. So my normal answer to that would be that you're going to look at the usage of the product, and you're going to make a reasonable decision based on your risk assessment of how long you think the product should be used. Bearing in mind that some people today are going to be on this call are going to be prescribing this for one-off users that may use it for a period of time. There'll be others at the other extreme end of the spectrum that may even be ward-based, and there may be many people use a similar product. So that's why we can't be any more prescriptive. Next question.
Okay, the next question is, when using the wedge for single-handed personal care, how would you advise adjusting upper clothing as the wedge will be in the way?
Yeah, that's an interesting one, and that's probably an example of where we can use a which actually we probably will come on to, but that's where we can use a phone conversation to go through that in a bit more detail, because practically with any kind of wedge or positioning product that's close up against the body, we need to consider things like that. we need to consider how to get in other items too, like slings. So that often is dealt with on a case-by-case basis.
How can overheating be managed? Also excess dampness in hot weather.
Yeah, that's an interesting question. So that question was, how can overheating be managed? Yeah, okay. My answer, my thought process on this, if I can go through it, these products, particularly a big one like this, are going to create some heat compared to not having anything next to the body. So that's a given. The question, however, is, are these going to build up excess heat, and what is excess heat and moisture? Personal experience with this one, I did use this for a period of time. It was nothing that serious. It was a 2-week bout of food poisoning, and this was a period of time ago. They can get warm and they can create a level of moisture. The only time that I would say, in my specific situation, I didn't find it a problem, but the only time that I would acknowledge it could be an issue is where you've got a facility like a care home or a ward where you've got a pretty high heat level, and then it's something that I would suggest would be part of your risk assessment that you would put in place. What I will also point out, though, is that they are waterproof and breathable, and the benefit there, if I just use this tube here, these are actually reasonably effective at wicking away heat and moisture. So what I mean by that is, if I push down hard on this end, hopefully everyone can see this, you can actually see that air moving around because it's not a solid product. So again, proof of the pudding is in the eating. It's not that you couldn't get an issue with it, but we don't tend to find a big challenge with that. And should we take one more?
Yeah, no problem. The next one is, I'm interested to know about suffocation risk with the long tube.
Yeah, good question. So suffocation or asphyxiation risk with the long tube. This is a subject I find very interesting. From a breathable perspective, these completely comply. They are breathable. Technically, according to the book, there's not really a risk of asphyxiation. However, you and I know, and this is a very current subject, but you and I know that any covering or layer near the nose and mouth is going to present a restriction to breathing. So obviously a mask. I don't know. We've left masks off today because we're talking, but it can present quite a significant challenge. Even if you're doing a mild amount of exercise, it's very noticeable having a covering. So I would say, again, it's part of a risk assessment. These are okay to be used in the context that they comply with regulations, but you're going to be using common sense. Where I would have a real concern is where you've got someone that is actually quite mobile and they're moving around a lot, and they could get themselves in a difficult position where asphyxiation could be a real concern and a real risk. I would then also consider, okay, does the correct use of a product like this mitigate that risk? I.e., will it calm them because of that tactile stimuli? Will there be much less movement than you might currently be experiencing with that person? So if it's all right, I think we're going to move on again. Pricing, if we get time, we can go through it, but they're all online. And if anyone wants a particular price list or a quotation, obviously, contact customer services, we can get that. But I will say that historically, before we started using the LEJRELET range, we've had quite a lot of experience with traditional bracketed systems. Now, it's quite normal to pay to build up a situation for a particular client that you can be spending £800 to £1,000 for one client. This has been designed deliberately with economy in mind. So even if you did buy the whole kit with the 250 tube, it's £474. So in general, I think there's efficiencies there, but we can talk further if we need to on that. Now, how do you get the LEJRELET equipment? In the normal run of the mill, pre-COVID, my second use of the word, we would do trials. We don't tend to find that client assessments, are particularly necessary due to the simple nature of the product. So we would tend to loan the equipment out. It's not that we won't come and handhold maybe on the first time that you use it. The challenge we've made at the challenge we've got at the minute is that we can't offer them out on trial. That said, we can do video consultations or phone assessments, and you can buy them online as well. So that as of I think yesterday, they're all on our e-commerce site. So hopefully that covers off on that one. Now, I did want to mention that if you do buy it as a kit, and this is the complete 250 kit in this bag, there is actually a discount for a demo kit. Because one thing we found works really well is where an OT team have got access to a kit, you can take the whole thing out, you can work out which product or which combination of products works for the client. There's no faffing around with going in and out, arranging assessments. You've got everything you need in one kit, and then you can come away and the correct kit can be ordered, or it can be obviously left in place and replaced. So if anyone's interested in a price on the demo kit, which is a special one-off price that can only be used once by any authority, then please get in contact with customer services and we can get you a quote raised for that. Is there perhaps, what's the time? We're running a bit tight of time. Can we take, how many more questions are on the chat box? Ish.
We've probably got about another 6 questions.
Can we take 2?
Yeah. Can the tubes go in the washing machine?
Interesting question. Technically, probably. Would we advise it? No. Washing machines are reasonably vicious animals. From a heat perspective, these can take heat of up to 95 degrees, but the answer is I wouldn't do it. I think it would probably shorten life expectancy
And
of the product, I should say.
Sorry, is this suitable for people with pressure care needs?
So the answer to that question, is it suitable for people with pressure care needs? Very much so. Has it been pressure mapped, or do we have a particular risk rating? No. The reason for that is there is millions of different ways we could use these, and it would be different for every single person. There is very little point in getting these pressure mapped. But what are we trying to do when we've got situations where we need to create pressure relief? Well, we are trying to maximize contact area. That's one of the key fundamentals. What are we doing here? We're maximizing contact area. Occasionally, we'll have a conversation with the tissue viability nurse where there'll be a concern as to using any particular products like this on top of an alternating air mattress. Yes, where the positioning product is between the alternating air mattress and the skin, there is no pressure relief from the alternating air mattress. But what we're trying to do, we're trying to maximize contact area, and that's a key thing. So it's an interesting conversation to have, but it's a very, very beneficial situation where you've got pressure relieving challenges, and I would advocate looking to this kind of product in that scenario. So I think that's probably all the questions we can take for today. There's 2 things I want to mention. Next week is our 3rd webinar. We are demonstrating the Razor emergency lifting chair and talking about how it can be used and how to prescribe it. And also, we would like you to stay on now. We have a short thank you video, which is for everyone in care, and that is every single one of you on the call. Please stay on to watch the video. Thank you for joining. Stay safe, stay well. Thank you.
Over the past few weeks, we've been amazed at the selflessness of all those in the care sector, from the NHS to domiciliary care workers and to workers at care homes, not to mention our colleagues in social care, and we want to extend a massive thank you.
Thank you so much.
Thank you to the NHS.
Thank you.
A huge thank you to the NHS, all frontline staff, key workers, and anyone else putting others' needs before their own at this time.
Thank you.
Thank you for everything you do. Keep up the great work. You deserve our utmost respect.
Thank you.
Thank you.
From me to everybody working in the NHS, as well as social care and family carers too, a massive thumbs up.
Thank you. Where would we be without you?
To all of you who are doing such a great job, thank you.
Thank you.
Thank you.